Done with leukemias, let's move on to lymphomas. Lymphomas are a white blood cell cancer, just like leukemia, that's the name of the game. However, unlike leukemia, where leukemia arose from the bone marrow and went to the blood, lymphomas arise from tissue, like your lymph nodes. So lymph nodes, that's where it gets its name, lymphoma. Now, just a fair warning, anytime you have an enlarged lymph node doesn't mean it's lymphoma. You can have it due to infection, so be careful. But in this video, we're going to be talking about enlarged lymph nodes due to lymphoma. Now, there are two types of lymphomas. When lymphoma was first discovered, it was discovered by a doctor named Dr. Hodgkin, who was a British pathologist, and he came up with Hodgkin lymphoma. And then further down the road, other people started to discover different types of lymphoma, and I guess as a homage to him, they just called it non-Hodgkin lymphoma. Now, these two types of lymphomas are not only just different types, but they also act differently. Yeah? So we have to distinguish them apart. One of the easiest way to distinguish them apart is because Hodgkin lymphoma is characterized by a special cell. These are your Reed Sternberg cells. Are these two nucleoid cells? Can be many things, but most of the time they are B cells. And these Reed Sternberg cells induce inflammation, they recruit cells, they induce fibrosis. So I'll write down recruit cells, inflammation, fibrosis. That is the defining characteristic of Hodgkin lymphoma. Because these cells cause inflammation, Hodgkin lymphoma is also associated with B symptoms. What the heck are B symptoms? B symptoms are just, I guess, generalized symptoms that you see in cancer. So things like weight loss, fatigue, night sweats. You know, those generalized symptoms. Why do they cause it? Because cells induce inflammation. Why they call it B symptoms? Because we stage lymphomas using the Ann Arbor staging system. And it goes by numbers 1, 2, 3, 4 on the staging system, and also A, which means no systemic symptoms, or B, which means you do have systemic symptoms. So because we have systemic symptoms, we call them B symptoms. That's just some background information. If they quiz you on that, then then you'd be very unfortunate. But now you know. That's why we call it B symptoms. Now that seems pretty bad just at first glance, but there is a silver lining, and the silver lining is that Hodgkin lymphoma is less aggressive than non-Hodgkin. Spreads very slowly, spreads node to node to node, so contiguous spread. Let's say node to node. That doesn't really make sense, but you know what I mean, node to node. So a slow spread, less aggressive. Okay, let's move on to non-Hodgkin. Non-Hodgkin is the more aggressive form. Unfortunately for us, it's also more common. Again, it doesn't have the Reed Sternberg cells, that's characteristic, so it doesn't have those cells. Because it's more aggressive, they might ask you questions about which has a poor prognosis, non-Hodgkin's, or which has a diffuse nodular spread. So if you have a node up here and then now you have a node down here and they're both the same cancer, they're thinking of non-Hodgkin because it's more aggressive. Or they have splenomegaly and there's infiltration to the spleen. Which one is it? It'll be non-Hodgkin because it's more aggressive, etc., etc. So there's many ways you can ask. So just know that non-Hodgkin is more aggressive. And there's one more thing I want to talk about is that Hodgkin lymphoma and non-Hodgkin lymphomas have association with things. Non-Hodgkin lymphoma is associated with autoimmune disorders, and it's also associated with HIV. Hodgkin is associated with EBV. In fact, about 50% of Hodgkin lymphomas have an EBV source. Again, we said EBV is kind of like the HPV of blood. It just causes so much cancers. So just keep that in the back of your mind. It's not a hard and fast rule. I mean, some Hodgkin lymphomas associated with HIV, some non-Hodgkin lymphomas aren't associated with these. So it's not a hard and fast rule, but As a general rule of thumb, I think it's good to know that Hodgkin lymphoma is associated with EBV, non-Hodgkin's lymphoma is associated with these. All right. This video we're going to talk about Hodgkin, and in the next video we're going to talk about non-Hodgkin. So let's start with Hodgkin. Hodgkin lymphomas, again, characterized by your Reed Sternberg cells. Those are your cells that look kind of like this, binucleated. Kind of looks like eyes. There's a really good picture in my notes. Again, very characteristic. And every time I say something's very characteristic, that means they can just show you that picture, say nothing more. You need to be able to list off all the facts you know about Hodgkin lymphomas, because that's probably what the question will be about. Again, we said it's a B cell. What were the markers for B cells? There's a ton of them. We talked about how 10, 19, 20, etc. Well, add these to your list. CD15, CD30. Easy way to remember, a good memory aid is 2, as in the number of nuclei times 15 equals 30. This is the normal characteristic Reed Sternberg cell, but just know there are variants depending on what kind of Hodgkin lymphoma you have. So some kind of look like popcorn. Just keep that in mind, okay? And again, these cells attract other cells. I'll just write other cells. It causes fibrosis, causes inflammation. There are a few subtypes of Hodgkin lymphomas, and we characterize the subtypes of Hodgkin lymphomas by seeing what kind of cells are around or seeing if there's fibrosis. I'll show you what I mean. If you have a patient with an enlarged lymph node and you're suspecting Hodgkin lymphoma, you biopsy that node, and you see a lot of sclerosis, a lot of fibrosis, we call that subtype nodular sclerosis. Hey, that's not too difficult. This is actually the most common subtype of Hodgkin lymphoma, seen more in women, and that's important because all subtypes of Hodgkin lymphomas is seen more in men, except for this one. So know that well. It has an enlarged lymph node, but one of the characteristic findings is an enlarged lymph node in your mediastinal. So mediastinal or mediastinum node, very important. You know, so if a gal comes in with an enlarged mediastinal node, enlarged some other node above the mediastinum, you're thinking of nodular sclerosis, Hodgkin lymphoma. And this one is not associated with EBV. That is your nodular sclerosis. If someone else comes in with a node and you biopsy and you don't see sclerosis, but instead you see a ton of different types of cells, a mixed bag of cells, you see plasma cells, you see histiocytes, you see eosinophils, plasma cells, etc., etc. We call this, fitting name, mixed cellularity Hodgkin lymphoma. Eosinophils is a big one, but you're just gonna see a hodgepodge of cells. That's mixed cellularity. Pretty easy, right? Another guy comes in. I'm saying guy because we recall Hodgkin lymphoma is most common in guys except for nodular sclerosis. Another guy comes in, has a node. You biopsy the node, and you're expecting to see some cells because they recruit cells, but you don't see anything. That's weird. If you don't see any cells, we call that lymphocyte depleted. And unfortunately for this dude, this is the one with the worst prognosis. Yeah, our immune cells actually can fight cancer not very well, depending on how aggressive the cancer is, but it can still mount an immune response to cancer. And if you don't have a functioning immune system, if you are immunodeficient or if you have HIV, etc., then you're not going to see any lymphocytes. Yeah, you're going to try to recruit them. Yeah, that recruitment part's fine, but nothing's going to come towards those Reed Sternberg cells because you just don't have them, and it has the worst prognosis of them all. Prognosis bad. That's just so dumb. I'm sorry. I was gonna say bad prognosis. I don't know what happened to my English. So bad prognosis. That's lymphocyte depleted. Last but not least, another patient comes in, has an enlarged lymph node. You biopsy that node, but this time you see a ton of lymphocytes. We call that lymphocyte predominant. This is actually the one that has a Reed Sternberg cell variant that looks like a popcorn. So I'll just write popcorn. I'll just write pop. I'm just gonna leave it at popcorn. So if you watch this video with no context, you don't know what I'm talking about. So popcorn. And this has a good prognosis just because you have a lot of lymphocytes. And again, lymphocytes have immune response to cancer. That does it for Hodgkin lymphoma. Next video, we're going to talk about non-Hodgkin lymphoma. Until then, see you next time.